Hi there, I'm Holly McDonald with the Costa Mesa Pod, where we discuss all things concerning the lifestyle, businesses, and activities that make our area such a great place to live. Today, I am bringing my friend and mobile chiro, Sarah Cathers, to the podcast with Sunrise Movement Chiropractic. I am so stoked to have you here. You literally, your name comes up in all of the social forums for what you do. So obviously you provide great service, but Sarah, thanks for being here.
Thanks for having me. This is a treat.
Yeah, I'm sure this is a little bit different from your normal
day-to-day. Yes.
So Sunrise Movement Chiropractic, can you explain, give us your elevator pitch of what you do? What does your business do?
So I am mobile. That is the biggest niche I think I have in the community. So I take chiropractic and I bring it into your home.
What made you decide to go out on a limb and do a mobile version of chiropractic?
I went in after graduating chiropractic school. I went into practice for about a year, and I learned the technique that I do now with patients, which is the Activator Method. It's a gentle, low-force adjusting style. And I just got burned out with the volume that I was seeing in the clinic, and it just wasn't the environment for me. So I decided that I needed to both spend more time with my kids, they were younger, and be able to, again, have that specialty that allows me to travel and be flexible with my time and be able to treat patients the way that I want to treat patients, whether it be both obviously adjusting, but soft tissue, some rehab, and figure out what actually is the root cause of what's going on in their bodies.
Well, I think it's appropriate to mention that we met through Trifecta Collaborative, which is a women's networking entrepreneurial group, and a lot of the base of it, a lot of the foundation is a lot of the working women are also moms and working really hard to establish their businesses in a way that aligns with their values and wanting to be there and present for their kids, which you just literally had said was part of what caused you to start the business.
I've loved it since day one. There are many networking groups out there, and this one just feels like home. Like you go in and people want to say hi to you. There's no cliques or little groups that you have to kind of squeeze your way into.
Yeah.
And again, we're all there to support each other, and it shows on our social media too, where we're helping each other grow and just be present in the community.
Yeah, I love how so many of the women that have been coming in and out of the doors there have been really, really strong-minded about wanting to build a business that encompasses all aspects of their life.
It's a work-life balance, and that's the struggle with every person's business in life, and it's really important when you realize how short life is. You want to do what you love and help the people that you're passionate about helping.
Yeah, well, and I think that's what's so great too about the why behind why you made your business a mobile version. Do you roll in and then are you there with them for a set period of time? Do they have a diagnosis already? Are you diagnosing them? How does it all work?
That's a good question. So I basically come in with just an open mind because I don't want to have patients think that I'm already know what's going on with them based on maybe a brief conversation or an email. So I go in, I explain my setup process. We talk about their history, so I've given them already an intake form that they fill out. So I'm able to know a little history about what's going on, but I want to get deeper into that. So I want to look into family history. I want to look into what do they do day to day? What are some of their hobbies? What things maybe can't they do right now that they want to be able to do? And then from there, I go into some we call orthopedic tests. So tests to determine, what things might be aggravated when I move your body a certain way. Things that they've told me that hurt when they go to lift their kid out of the bathtub, or they're doing dishes and their low back hurts. Things like that I kind of put in the back of my head, and these tests kind of provoke certain aches and pains. Those aches and pains are a diagnostic tool. So using that, I then talk about what I'm doing, why I'm doing it, tell them exactly what I'm going to be treating. I do, again, the gentle adjusting style, which is using the activator, so to align the spine, aligns the nervous system, which then tells the muscles to relax. That's usually what we feel first, is that muscle pain, the ache, the dull, deep ache, sharp pain. We want to get rid of that. And then we want to get those joints moving in that space so that the muscles can then do their job, which means not hurt, not give you grief when you're doing certain activities, and get you back to doing what you love to do.
As you get older, it feels like your body is just like, oh, why does everything hurt? Is that normal?
Yes, our bodies are changing, there's no doubt. But to be able to keep the joints fluid and to keep your body moving in a way that works for you is exactly what I want patients to be able to feel once they have been treated by me and maybe continue the treatment. And it's not for, a set duration of time. It's based on how your body responds to treatment. It's based on what you do, because we all aggravate our body time to time depending on our activities.
Yeah.
So again, it's just keeping us movement is lotion, as they say. Motion is lotion.
And that's part of the name of your company too, which is perfect.
Yep, Sunrise Movement Chiropractic. Keep your body moving and doing what you love to do.
Well, and you do a lot of moving, and you post a lot about it on Instagram. So, obviously that's part of your passion and what you enjoy doing. But did you always enjoy movement, or was it something that came about just from being in the field that you're in?
No, I've always been an active person. I've always been in sports. I've always loved to hike. I love to bike ride. I mean, you name it, and I love to do it. I've hiked the TMB, which is a hike in France that covers 3 countries, and you travel over 100 miles, and we did 7 days. So again, being able to do things like that, I'm not sure I'd ever do it again, but it was a good experience. So again, I love seeing how my body responds to different activities. And as we age, you have to change your mindset. You can't do the same things that you did when you were 18 or in your 20s, but you can still do the things, just modified.
Yeah.
And so that's what we have to think about is, what can we do and what do we enjoy that's going to keep our body moving?
Yeah. Well, and you have a really positive mindset, I will say, from what you post, even when people are going through hard times, finding the positive way to reframe it. I know that you recently had a surgery, and I'm sure that threw all sorts of kinks into your plans.
For sure.
Yeah.
I had a hysterectomy back in October of 2025. And so with that, again, there is definitely a healing journey both before and after surgery. So figuring out how your body responds to its new normal, how to really get through that inflammation phase, how to eat right, exercise, try to keep that mindset positive, because there are some times that these obstacles really push you down. And so you have to be able to push through things, because no matter what happens in life, there's going to be obstacles. So at this point, I feel really good. I've been exercising pretty consistently. Again, taking care of my body, because as they say, you got to take care of yourself before you can take care of others.
Yeah, so. Definitely. Did they give you like a lot of prep before you went in for the hysterectomy, because you said there was like care to take for yourself beforehand?
No, I don't think our medical system really prepares you for any said surgeries. But as we've been told, or as you know, like you should be in your best shape before going into surgery, which gives you the best outcomes. So we can't always put ourselves in that situation, but to be able to, again, know what to expect. And again, I think that's a really powerful thing in social media these days, because there's so many resources for people to find out information and to become part of a community, whatever that might be, to educate yourself as to what to expect and how to get through it. Yeah,
and I think it was 2012, I had a myomectomy. I might be saying that wrong, but they like take out, it was a fibroid. It was a giant one though, and they took it out, and no preparation. It was just kind of like,
this is what we're doing.
Make sure you have a ride home from the hospital, and that's it. And like, I went online and did the deep dive, which was terrifying.
That can't be too much. Yes, correct.
It was like, you might not be able to drive for a couple of weeks, and yada. I was like, what? No one told me anything.
Yeah.
So, I mean, I know things have gotten a little bit better, but back then that was scary.
Yeah, our bodies don't know how to recover on their own, but they do in the same token.
Yeah.
But having the help of someone or a resource is super important, because we want to be seen, we want to be heard, we want to know that we're not the only ones that feel like this.
Yeah.
So
I want to touch upon something that we talked about a little bit before we started recording, but you're going into people's homes. People are usually used to like going to their doctor or their provider at an office. it's kind of a different mindset for the person getting treated. Now, for some people, it's just like a luxury, right? Like, I can have somebody come to my house, of course, but for other people, they are a lot more hesitant to invite people in. Maybe they're afraid of judgment, or they're afraid of, I don't know, it could be anything, right? But they're not comfortable with having someone come in to give them that treatment. Do you think that that may prohibit people from even reaching out? And also, I think a lot of people don't realize that it's even an option, that they could have somebody come to their house to take care of them.
Yeah. I mean, there's a lot of mobile services these days, as we're aware, as COVID changed our world, right? You can have things delivered. You can have massage therapists. You can have almost anything. Dog groomers come to your home, right? But chiropractic is not as, not as widely noticed. So I can see the hesitation with people and wanting me in their home, because some people may be intimidated by maybe what their house looks like, or afraid of that their dog's going to bark, or that their kids are going to be in the way, or what have you. But those are all things that can be worked around. I'm not going into someone's home judging what their home looks like. I'm going in to make my patient the center of my attention, and to be able to get them to feel however they want to feel. I've had patients that have had surgeries. They can't leave their home.
Yeah.
Some patients of mine haven't been able to get out of a chair and sleep in their own bed. So I'm able to go into someone's home and gain their trust, which is super important. And I'm able to see what they do day to day. So if they're unable to get in their bed, I've had patients that I've been able to walk them into their bedroom and show them how to get into their bed properly after care or after surgery. I'm able to meet all of their family dogs or cats, which is, obviously a huge win. I love that. And I'm able to meet their family. So whether they have their husband home, or maybe they have friends in from out of town, or you name it, I'm able to go in and kind of warm up to them too, because sometimes people don't know what chiropractic is at all, and the benefits of it. And so to be able to educate, which I love my job for that purpose, is to educate what your body can really allow itself to do with the right care. And we've all known people that have struggled in life, whatever that is, mental health, the physical ability to do something, and that doesn't seem like a way to live.
No.
And I want people to be able to live the best life until they're not here.
Right. What made you go into chiropractic in the first place?
My late husband got into a motorcycle accident, and he had broken a bunch of facial structures, cheek, jaw, had his jaw wired shut for about 6 weeks. And at that time, there was no physical therapy prescribed. There was just, okay, you go through this, stint of having your jaw wired shut, we take it off, and you go on with life. But he was having some excruciating neck and jaw pain, headaches, and things like that, and we finally decided we should try chiropractic. And we found this chiropractor that did wonders with getting his neck and jaw pain at a level where he wasn't having the migraines and having the intense neck pain. And so I was like, that seems like a really worthwhile job. And so that was a track that I decided to take. But at that point, I had 2 young kids. And so, again, that process of going to school at night, working during the day, supporting a family, that was a long process. So inevitably getting into school and getting into chiropractic later in life definitely is a huge advantage in a lot of ways, because I had the dedication and the drive to really do well in school and, become successful at what I do and passionate about what I do.
Going into this later in life, like you said, like it was not your first career, but because you had such a strong reason, like you saw it in action, you saw how it could be used to make something better.
Correct.
It made you like, I am not going to just, cram for this test last minute.
Correct.
Maybe you did a couple of times, but you really you knew what you were up against.
Correct.
Yeah.
Correct.
You knew the whole drill.
It changes the whole mindset. Like it really is as we, in our 20s, we don't have that same drive. Most of us don't. There are definitely some that do, but to be able to really have the purpose and experience life before you go into a program like that was a different.
Yeah, I'm sure that program is no joke.
Yeah, exactly.
Yeah.
I would never want to do it again. But I love the continued learning, and I love just the benefits of chiropractic care in general. And I see it on myself, I see it on my patients time and time again.
Yeah. Well, I mean, whenever I see somebody looking for a mobile chiro, which apparently many people are, I see it on so many community forums, people looking. I see your name come up a lot, people recommending you. I recommend you too. So obviously there is a need, and just letting people know more about the benefits of it, and that there is somebody that can come to them and spend a little bit more time with them.
Yeah.
Just like you said, a lot of times going into an office, like it's overwhelming. There's so many people coming in and out the doors because that's how it works in an office space.
Yes, exactly. So I get the ability to spend, I mean, typically my treatments are about 20 to 30 minutes depending on what's going on. So again, it's a full body assessment. It's working on whatever situation has come up maybe in the past, 2 to 4 weeks depending on when I've seen you.
Yeah.
And we're working towards whatever goal you might have for that moment in time.
Yeah.
So, and it changes based on lifestyle, based on job duties, based on, what kind of fun things you do on the weekends, all that kind of stuff.
Who should reach out to you? What would be, aside from like surgery, let's say, is it just pain? Is it?
Well, pain is kind of the last sign that you get when something's off. So being able to take care of your body before you get to that pain stage is really important. Mm-hmm. Every person's body could use a tune-up. Every person's nervous system can gain from getting a chiropractic adjustment, whatever method that is to you.
Okay.
Because the nervous system controls everything from our stress to our sleep to our anxiety to what our muscles feel. So there's a lot of inner workings that isn't just about pain.
Yeah.
Pain is the last thing people feel, and then people want chiropractors or anyone to get them out of pain quickly. And it's harder to get you out of pain than it is to keep you feeling good and continuing to do your day-to-day life. Okay. I typically like to see patients at first, typically once a week if there's no significant pain or issue that's underlying.
Yeah.
A lot of my wellness patients will come in every 2 to 4 weeks.
Okay.
So I visit them.
Yeah.
And take care of their bodies to just keep things moving along. You know what I mean? Like we want to make sure that you are sleeping well, that you're eating good, that you're drinking water, that everything in your body is functioning at top of its game so that you can do everything you want to do in life and not worry about that, because we have many other things to worry about.
Oh yeah. I think like my mental image of chiropractic is still just like your back being like
well, and that's the thing with the technique that I use. So people think of chiropractic when they see it on social media and they see the big crack and they see the neck being forcefully pulled. Those are techniques, and those do work. I have just found from personal experience that a gentler approach for most people is beneficial. Now, what we call a manual adjustment, where you see the neck being turned and the back being adjusted, those are all valid ways to adjust the nervous system, and it works. But the way I choose to adjust allows people to feel a little bit more comfortable. They don't have the tension in their body. Sometimes our bodies will innately kind of contract a little bit when we're put into a position that may not be comfortable for our bodies. So to be able to allow the body to relax during the adjustment process, the soft tissue work, those are things that make my style of adjusting just a little more gentler. And it may take the stress out of what people might think or feel.
It's like your nervous system goes crazy just thinking about how nervous you are.
Exactly.
But I mean, the nervous system is obviously it's a big topic that people are talking more about now than they did in decades past, and it is important because we are all overstressed and overstimulated and everything. So I guess it all goes together. It really is like a whole body assessment.
It is, and the body is all one thing. It's not just one piece, but we treat it sometimes as this needs to adjust this and this needs to address this, but unfortunately it's all one. And so we need to let it all talk to itself and communicate efficiently so that we run at top power.
Well, I have heard nothing but good things about your services, and obviously you as a person I adore, and I'm so glad that we've connected. And anybody in the area, like Costa Mesa or anywhere nearby, you can service.
I do. I travel pretty much throughout Orange County, so Huntington Beach is my home, but the surrounding cities are just as important, and I'm there for anyone who may need my services.
Okay, so where can people find you on social media?
So my social media is Sunrise Movement Chiro. I have a website you can book directly online, and there are links in all of my bios on Instagram and TikTok.
Okay. Well, it's always so good to get to know members of our community that can help each other live their best life. And so I'm so glad to have you on the show today. Thank you so much, Sarah.
Thank you so much for having me.